I don't think there's anything that ever prepares a parent for having a child with a rare disease. Shira was healthy for the first 11 years of her life, at least seemingly healthy. And she was very active in musical theater and in voice and dance. And then our world changed. It was like a personal earthquake after a dance injury.
I was having horrible symptoms. I was having cognitive issues. I couldn't do math anymore, couldn't read, I couldn't write. I was having headaches, all of these things that nobody could really explain until we came to UVA and saw Dr. Liu.
In terms of vein narrowing, such as in Shira's case, we're able to identify a vein that appeared to be narrowed. And I think after a long discussion with her, she decided to bite the bullet and proceed with placement of a stent. And one of the nice things about this procedure is that it can all be done through a puncture in the top of the leg. One of the most challenging things for patients with Ehlers-Danlos syndrome or EDS is that there's not one physician that can manage all of the issues that these patients have. And so they end up having 40 or 50 different specialists to take care of the different problems that they have.
Shira was actually under the care of Dr. Liu. She had done well with that, had subsequently gone home, and then was about 2.5, 3 hours away, and we got a call that the access, which in Ehlers-Danlos patients can be very complicated, there may have been a problem with it.
Dr. Upchurch, he fixed my femoral artery pseudoaneurysm, which had I gone on the plane home with that, I would have died because it would have popped. So I'm forever grateful to both of them, and I can't say enough positive things about them. When I was like 11 years old, I started writing under the pen name Sick Chick, and now about a year and a half ago that turned into a whole organization called Sick Chicks, which is uniting and empowering young women to be more than our illnesses. I have also worked on a lot of legislation. Currently, actually this very second, I'm co-hosting a cyber rally with some friends for 21st Century Cures legislation that we're trying to get pushed through, because rare disease patients, we don't have time to wait.
People who've been lucky enough to meet her have been touched by her glitter. And I know, like I've said, Shira doesn't know how long her life will be, but she's going to make the most of every day.
Coming back to UVA is like coming back to a second home, and that's not something I can say about any other hospital.